Welcome back to Anderson Acres. We're here inside the barn today because we're having a little bit of a blizzard. He doesn't care, but we're having a little bit of a blizzard. We got chickens, we got ducks, we got goats. We got a little everything with us here. So, today we're talking about goats again, and we are going to talk about more medical problems your goat can have. I know it sounds like there's a lot, but it's just best to be prepared. So, a couple of people asked me if I could discuss listeriosis and goat polio. Now, they were asked in separate comments. However, I'm going to talk about them at the same time. Thank you, Duckles. Quack, quack. But I'm going to talk about them at the same time, mostly because I think it's really important to talk about them together because they have a lot of the same symptoms. Okay. So, oh, stop harassing her. She doesn't want to be your baby mama. Oh my God. It's like harassment central in here. Anyway, not the point. So, listeriosis and goat polio. They are both serious metabolic conditions with very similar symptoms, but very different causes and very different treatments. Okay? So, they're both more common in goats that are confined, so have smaller spaces, can't get around, and have lower fiber diets, so goats that are more on feed and less on a lot of hay, which we obviously have a lot of hay in here right now. So, hi Whiskey. Dogs. There's dogs everywhere. So, it is something that is often caused by a change in diet. Especially if you have moldy feed or forage all of a sudden, or if the pH of the food is different. Change in feed can upset the rumen, which can actually mimic the symptoms of both of these things. Okay? Listeriosis specifically, okay, just listeriosis now, is also called circling disease. Okay? This is caused by a bacteria. It has two different forms. One of these forms causes abortion in pregnant goats. The other one, here's Shadowfax. Your bum is in my way. I'm going to stand over here. Shadowfax just likes to get involved. But, okay, not the point. So it is caused by a bacteria. The first version causes abortions in pregnant goats. The second version is far more common. The second version is a neurological version, and it causes encephalitis, which is essentially the swelling of like the brain stem and the brain itself. This is not fun. It can cause one-sided paralysis, drooling, stargazing, where they kind of look like they're always looking straight up all the time. That's not fun for them, but it's a symptom of a lot of different things. There's a duck eating a bunch of snow. I don't know. Whatever. So it can also cause, listeriosis specifically, can also cause stumbling, lack of appetite, depression, fever, and it can be passed to humans through the milk. So if you have a goat infected with listeriosis, do not drink the milk. Okay? Stop drinking the milk. Get your goat to the vet. Get the appropriate antibiotic treatment. You do need a full-on course of aggressive antibiotics to fight listeriosis, or the goat is going to die. Okay? This is not a case where you should try and treat it home first. Get to the vet, get the antibiotics, administer the antibiotics as directed by your veterinarian for your goat's weight, because it's usually based on weight. So, administer those antibiotics. Don't try and treat listeriosis at home. It's not going to happen. Okay? Listeriosis is very serious. Polio, on the other hand, is not as big a deal. I know we're all scared of the word polio because of the human polio, but human polio is a virus. Goat polio is not related to that at all. Goat polio is actually a vitamin deficiency, and it mostly affects weanling or yearling goats. Okay? So young goats that are not drinking from their mama anymore, but are also not fully grown. So after you're out of that phase, it's less of an issue. But goats that are young, growing, but not feeding from their mamas, it can be an issue. Now, the vitamin that they are deficient in, if they have goat polio, is actually B1, also called thiamine. Okay? What can cause this deficiency? Well, too much grain, prolonged or excessive use of antibiotics, or the incorrect use of antibiotics. It's one of the reasons you should not use antibiotics unless you know what antibiotic you're using and what it's for. You shouldn't just randomly start administering antibiotics every time your goat is sick, because one of the things that can happen is a vitamin deficiency, and that's no good. Other things, again, changes in the diet. So sudden changes in the diet, especially changes that might lower the pH of the rumen, because this causes decreased thiamine production. Thiamine actually processes sugar. Okay, without thiamine, your body can't break down the glucose. With no glucose, brain cells die, and some of the neurological symptoms that you might see are like hyperexcitability, staggering, weaving, circling. In extreme cases, maybe blindness or tremors or many other neurological symptoms. Very much like listeriosis, but not the same cause. If a goat with goat polio is left untreated, they will probably die in under a week. If it is treated, the prognosis is good. They go on to make a full recovery, and they are fine. So get it treated. The way to treat it is an injection of thiamine, preferably administered by your vet, but a thorough injection of thiamine via IV, so intravenously, okay? Even if it's not administered through an IV, it still needs to be administered into the veins, intravenously, okay? So it's important that you get a vet to do that, unless you're really good at intravenous injections yourself, and I'm not. I'm really afraid of needles, and even if I'm not afraid of needles, I'm really bad at finding a vein. So that's not something I do myself. I get a vet to do it. Preferably, you should have your vet do it. They know the dosage. They know what they're doing. They know what they're using. So if you can, you should definitely have a vet do it. But the prognosis is excellent for goats that get treated for goat polio. It is very poor for those that don't. It is almost impossible to correct it via diet. Whiskey's here now. Almost impossible to correct it via diet because you don't have enough time. So in theory, you could correct a thiamine deficiency with diet, yes. But once they're exhibiting symptoms of goat polio, it's too late. You need the injection. So don't try to wing it. You need the injection. Anyway, those are just two of the things that could happen with your goats. And those ones were by request. A couple of people had asked. They are very similar in presentation, but they are not related to each other. Okay? Listeriosis and, thank you guys, and goat polio are not the same thing. They're not related. They just kind of present the same. So it's one of the reasons you should call your vet, find out what exactly is wrong with your goat, and then treat it appropriately. Anyway, that is about it for us here today at Anderson Acres. I hope your goats are happy and healthy. We'll see you tomorrow.